So good morning again to members of council. Thank you for the opportunity to provide a public health update on COVID-19. Today, I will update you on the local public health surveillance data, including recent trends and variants of concern. I will also provide an update on the status of the COVID-19 vaccine rollout in Halton. These beautiful Japanese cherry blossoms photographed at Spencer Smith Park in Burlington are a reminder of the hope for a better year to come as we lean into what I hope is the home stretch of this pandemic, with a bend in the curve of the third wave of the pandemic and a rise in our vaccination rates. Next slide, please. As of May the 17th, Halton has seen nearly 17,000 cases of COVID-19. This includes 553 cases that are active right now, and sadly, 220 deaths. This graph shows the number of new cases per day broken down by whether they are known to be variant cases in green or non-variant cases in gray. Please note that the orange line on the far right indicates the most recent days of data when variant cases are likely to be underestimated because the results of mutation testing take longer to be reported. The 7-day rolling average has begun to slowly decline since last month. We are now seeing an average of about 80 new cases reported per day, which is lower than our peak rolling average of 163 on April the 17th, but it is still quite high. This means the provincial lockdown imposed in early April is having an effect, but the initial chains of transmission from the third wave that were already set in motion are running their course. Next slide, please. While the incidence rate of cases is trending downwards, it is doing so gradually. The rate remains well above the recommended threshold of 25 per 100,000 shown by the orange line. In fact, over the most recent 7 days, despite decreasing case counts, the rate is still sitting at approximately 86 new cases per 100,000 Halton residents. Therefore, it will be critical to avoid reopening too soon. With new and more infectious variants circulating in our community, we do not want to risk losing the gains we have made through the lockdown and through our vaccination efforts. Ongoing high cases were likely an important factor in the provincial decision to extend the stay-at-home order until June the 2nd. Next slide, please. This slide reiterates how the third wave continues to be dominated by variant cases. By April, over 70% of new Halton cases reported each week had a variant, and this has continued to be the trend into May. As shown in the table on the right, the majority of variant cases in Halton have had the B117 or UK variant. We've had a smaller number of cases with the P1 and B1351 variants, and recently had 2 cases of the B1617 variant, which is the variant first detected in India. These cases remain under investigation. About 12% of variant cases have been found to have a mutation, but further testing is needed, if possible, to confirm which type of variant they have specifically. Next slide, please. This slide shows the proportion of new cases on a given day that fit into each age group, averaging out the past 7 days for each data point. The proportion of new cases among residents aged 80 plus, shown in black, has remained low, thanks to widespread and early vaccination of these residents. Residents 80 plus are now accounting for fewer than 2% of new cases. Residents aged 60 to 79 years of age represent about 10% of new cases lately. Therefore, the bulk of new cases continue to be concentrated among residents who are of younger age groups. Next slide, please. Unfortunately, we are continuing to manage a high number of outbreaks in workplaces, with 23 active outbreaks on May the 17th. After a milestone 2-week stretch with no outbreaks in institutional settings, we have recently experienced several small outbreaks in long-term care and retirement homes, all involving unvaccinated staff as index cases, but some cases in residents who are also vaccinated. Thankfully, these outbreaks tend to be short-lived and are not causing the kind of devastation we used to see in long-term care homes, thanks in large parts to vaccines protecting our elderly and due to these homes having more practice in implementing strict outbreak measures with the assistance of public health and our hospital partners. Next slide, please. As mentioned in the last update to Council, we reached a record number of COVID-19 patients in Halton hospitals in mid-April. Since then, we have begun to see a decline, with 71 COVID-19 patients currently occupying beds in Halton hospitals as of midnight on May the 17th. This includes 58 patients at Halton healthcare sites and 13 at Joseph Brant Hospital. Among those 71 inpatients, 29 or 41% are in the ICU. However, these numbers remain relatively high, being roughly comparable to what we were seeing at the peak of the second wave. At the time a snapshot of inpatient demographic data was provided to us by hospitals, which was on May the 17th, 31% of COVID-19 patients at Halton healthcare sites were Halton residents, while 69% lived outside of Halton. Similarly, 33% of COVID-19 patients at Joseph Brant were Halton residents, while 66% lived outside of Halton. Of course, we do not know how many Halton residents are occupying beds in hospitals outside of Halton, as hospitals throughout Ontario share the burden of COVID-19 patients. 51% of COVID-19 patients at Halton Healthcare were under the age of 60, compared to 40% at Joseph Brant. None of the patients across the Halton hospitals were known to reside in long-term care homes.